A very good morning to you. How are you doing? I hope that you're well, you're happy, you're blessed. Karibu sana. I'm so happy and excited to have you here. Thank you so much for choosing to watch MBCI TV, ambapo tunabadilisha maisha by the grace of God. A big shout out to everyone who's following us through our social media pages. Thank you so much for tuning in. It's our hope and prayer that today you will get blessed. And of course, on Afya Clinic is where we talk about everything health. So I know that today you're going to learn a thing or two about health. So what you should do is share the link with other people so that they get educated as well. All right? But officially, Karibu Sana, this is Afya Clinic. This is where we talk about everything that concerns your health, our prayer. Everything that concerns your health to break down in a way that you are able to understand. All right, so Karibu, be having an amazing time. We'll be here up to 10 in the AM. My name is Rachel Kahugo. Today we are live on MBCI TV. Live on MBCI TV Facebook page, or live on MBCI TV official YouTube page. And today we're talking about a disease that people have asked about a lot of times. But before I tell you what we are talking about today, is that we are grateful that you are here today. It means that you're alive, and that is such a blessing. So I'd like to know how your week has been from the last time we were here, but also how your weekend has been. You've had such a long weekend. I had someone saying on Thursday, leo ni Friday, kesho ni Friday, kesho kutwa pia ni Friday, you know. So it was such a long weekend. So I'd like to know, how was your weekend? Did you celebrate Mashuja? And who was your Shuja? Who did you celebrate? Yeah, so we'd love to hear all of that from you, and for that our numbers are very open. That is 0721 105 105 on WhatsApp, 23814, our SMS code, which is absolutely free of charge. We're live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page, and we'd be happy to hear from you. Now, our today's topic is blood infection in layman's language, as many people would call it, but in medical terms, inaitwa sepsis. Am I right?
You can call sepsis, you can call it septicemia.
Okay, acha tuite sepsis. Tulisema mkiniona Afya Clinic mnaita Dr. Kahugu. Sawa sawa. So in medical terms, we can call it sepsis, and we'll be getting to know more about it. But in layman's language, you're used to calling it blood infection. A lot of times people say, unajua niliambiwa niko na blood infection, unajua niliambiwa niko na blood infection. But as we've heard from doctors, is that blood infection is a complication of something else. So today we want to break it down to help you understand what is blood infection, how does it come along, what are the causes of blood infection, how would you know that I'm at risk of getting a blood infection. Yeah, how you're able to treat it, how bad can it be? Because if not treated, it can be really deadly. So we'll be able to unpack all that. So if you'd be having any question about the same, as I said before, our numbers are very open, and we'd be happy to hear from you. So do not miss out as we're having this conversation, and we'd be happy to hear from you. And also, we'd be happy that you'd be getting to learn these as well. Now, today we're here with Dr. Steve. And Dr. Stephen Mutemi has been here not once, not twice, and every time we have him in studio, we are able to learn a lot of things. The other time we were talking about sickle cell, and we were able to really unpack that and know what sickle cell is. So today, as we'll be talking about blood infection, I do hope that you're going to learn a thing or two. So he's from ClearScan Medical Solutions in Nakuru, and because he's here with us, he will be introducing himself. Karibu sana.
Asante sana.
How are you doing?
I'm very fine, Rachel.
Good morning.
Thank you for having me. Good morning to you.
Asante.
Yes.
Asante sana. Now, before we even do the introduction part, juzi ilikuwa Mashujaa.
Yes.
Who did you celebrate? First of all, did you celebrate?
Yes, I did.
Okay.
I did.
Okay.
And that was time to celebrate my dad.
Yeah.
May he so continue resting in peace.
Amen.
I also celebrate my mom, who has been very supportive in my journey or in my life. Yes, yes.
All right, amazing. Please introduce yourself.
As you said, my name is Stephen Musyoka, a clinician, a specialist in medical diagnostic imaging, a founder of the ClearScan Medical Solutions in Nakuru, where we do what we are doing here, and also, but most people know me for ultrasound scans, but I also do general practice, and that's what we are doing in Nakuru to better the health of the population, not only here, but everywhere else where we are called to do that. Yes.
Amazing. And you say that you do general practice.
Yes.
But you really, you know, concentrated on doing ultrasounds and scans. Why exactly ultrasounds and scans?
The reason for the specialization was very simple. As I was doing my general practice, I realized there's a gap in that sector of health provision, and I decided to go and specialize on it so that I can reach out to as many people as possible. That was the reason why I went to specialize with ultrasound scans. And it's good that you asked. This month, by the way, is a month that we are celebrating everything to do with ultrasound scans. We are trying to inform people the importance of ultrasound scans. And also, because we're talking about the month, I have just remembered there was a time I was seated in this studio in October, and we were talking about breast cancer. And again, it being a breast cancer awareness month, I cannot fail to mention that we are doing breast cancer awareness, which is very important, very key to me, because I like talking about it passionately, and most of the time because I know the impact it can have in changing somebody's life. Yes.
I love that. Last week we were talking about breast cancer, and you really told people to go get checked and just do your scans just to make sure that you're okay. And we also told people about how to, you know, do self-assessment just to know, am I okay? Yeah, just to know, is this a telltale sign? Should I go get checked? So now that you've mentioned that, that's very important. And as we end, we'll be telling people where the clear scan is so that they'd come and do their scans just to be sure to Wasawa.
Sure.
Yeah. And also, maybe this is just the right place to mention that this is also Pregnancy and Infant Loss Awareness Month.
Yes.
Yeah. And it's something that we've really talked about here as well, so many times. But it's just very important to also, you know, tell everyone that if you've been through that journey of pregnancy or infant loss, we see you, and we are here to tell you that, you know, it's possible to have a successful pregnancy journey. We've talked about pregnancy so many times, maternal health so many times. So if you have any question about that as well, tutakuwa tukiguzia tu kidogo, because at some point this month we'll also be having that conversation. All right? Now, today we're doing blood infection. Let's start from there. Blood infection in layman's language, ni nini?
In layman's language, when you told me to talk about blood infection, what you've just said is what I thought. How do I put blood infection in layman's language? Because I was trying to do the translation and see how I can make it very simple na naona inakuwa ngumu kidogo. But basically we know infection ni kugonjeka kama ugonjwa. And as we have the body with the body parts and body systems, we have the GIT, or the gastrointestinal system, the respiratory system, the nervous system, the cardiovascular system. Now, when you talk about the blood, then the system that comes to us, comes to mind is a cardiovascular system. And as I said, the body is made up of systems. And the reason they are system is because there are several organs connected together, doing a particular work in your body aimed to achieving a particular goal. Just like the one I'm talking about now, the cardiovascular system, which usually helps in moving the blood around. And now this blood has other functions that it's doing, or it has other factors or other ways it is helping the body stay healthy, as we talked about now, the general health of a human being. Now, having said that, any other part or any other system can get infected, and the cardiovascular system can also get infected, and it can be infected in many ways. And one of the ways that can get infection, ama venye inaweza pata ugonjwa, ni kupata infection ya blood itself. We know blood is ni maji, it's fluid, it's flowing through the veins, it's flowing through the heart, or that. So when we talk about blood infections, we are talking about now having an infection which you can now find in the blood itself. Yes. Now, this infection that can be found in blood can be caused by all those other things that cause infections that can affect all the other parts of the body. This includes now bacteria, This includes viruses. This includes protozoals. This includes fungus. Yeah. So when we are the infection is caused by either of those, then we have a specific name for that, which we are going to be talking about. If it's bacteria, we call it bacteremia. If it's virus, we call it viremia. All that.
Okay.
So it's just an infection of the blood itself by all those organisms that can cause infections.
Okay.
Yes.
Okay. Perfect. Now, we've mentioned about sepsis. Is it another name of blood infection? Is it the same? And
now,
if they're different, what's the difference?
Now, the difference is basically when we talk about blood infection, I think blood infection is the simplest, as you say in layman. So that's more of a layman's language. When we talk about blood infections, talk about medical, we talk about septicemia. Now, septicemia is that transition or that point whereby you get infection on the blood or you get blood infection. Now, when you get blood infection, what usually happens is that because blood is going through all the organs, remember, the blood will circulate through every organ several times a day. So you can imagine, now this blood has bacteria, for example. Now, it means that these bacteria are being transported to these organs in the body, and one of the organ or the system in the body, we call it the immune system. Now, when the immune system detects these viruses or these bacteria circulating in the body, what will the body do? The body will mount what we call an immune response. Or the defense mechanism. To say in layman's language, KDF inaitwa. Kujeni, there are some invaders or the intruders who are circulating in our system. So we need to get them out. Now, most of the time the body will be able to contain that, but there are other factors that will determine if the body is going to contain the infection that is the blood or not. Now, sometimes the immune response might be excess. The body responds like even KDF walikuwa kuja 100, they come like 100,000. So you can imagine what is going to happen there. The fighting that is going to be there, it's a bit too high. So the response, because the mechanisms or the chemicals that are supposed to be produced to fight these infections, that come too much, and then they overwhelm the body. Now, when they get that point, when the immune response is too much, the system, it becomes overwhelmed, and now talk about sepsis. Now, sepsis is more serious than septicemia.
Okay.
Yes.
Okay, I hear you.
Now that's the difference.
Septicemia and sepsis. You know, this concept of how you've explained it is very interesting, because sometimes we talk about the body not having enough immunity, and so unakoko too weak because, hey, you need help. Your body doesn't have enough immunity. But now here we're talking about your body having excess of these. Is there any way you can contain it?
There are several factors. Personally, as a person, there's nothing we can do about it because it's natural, right? Because it's the body that decides. It's the signals that are sent to different parts of the body, and now they mount or they respond. You see? Now, if the response is normal, then nothing is going to happen. But sometimes you might find the body is overwhelmed by the response. And again, there are other factors now that will determine how much your body is going to respond to the infection. Because ideally, we talk about the immune system being normal. We can talk about the immune system being weak, right? Now, that now brings another dynamic. If your immunity is low, you are now more likely to get septicemia and sepsis than somebody who has a normal immunity, right? So we're talking about the dose, for example. That's the best example that I can give, that if you have a very high dose of the offending microorganisms, say for example you have the bacteria that has been introduced or that has reached the bloodstream, if the number is too much, then the response has to be too much. So that means that now this fighting in between, now your body becomes the nyasi.
So the body inaumia.
Exactly, now inaumia because of the overwhelming response that comes along with it.
I hear. Now, let's talk about, now that we've been able to understand what the difference is between the three, now let's focus on blood infection, because I'll be under the most layman's, as we've said. Now, what are the causes of blood infection?
Now, as I said, the specific causes are the organisms that cause infections, including the bacteria, the virus, the fungus, the protozoa. Those are the causes of blood infection. If they get away into getting to the blood system. So now the question is, how now do they get into the blood system?
Also you mentioned that it's secondary. Haianzangi tu as uko na blood infection. It has to be ilianza mahali, and then it becomes a complication to now becoming the blood infection.
Exactly. And now that's what we need to understand now, because most of the time you'll be told, you go to the hospital and be, you have this, but this infection is getting into blood. Now you're having a blood infection, and you're also having a primary infection. There are some situations when you can introduce the infections directly
to the blood.
Yes. For example, we talk about people who abuse drugs, or the drug abusers who usually inject themselves. So when you're injecting yourself and the things that we're using are not sterile, because of most of the time you're not observe sterility, you can inject yourself, and then you introduce bacteria directly into the bloodstream. For example, the skin. We usually talk about what normal flora, the skin having normal bacteria, even yours and minus Staphylococcus aureus. So anytime you break, it gets a chance to get in there. So these needles they are using, remember, the drug users, they usually share needles. They don't keep them safely. They are not sterile, so you can introduce bacteria directly. Or even as we offering care, usually see when you go to the hospital, they have to clean the cervix that they're about to prick, and with the alcohol that they can make that it is sterile. So that when they prick, they cannot introduce the bacteria directly into the system. That is one way that the bacteria or the viruses or any microorganism can get directly into the system. But now most of the time, you find that again, the bacteria can get into the system following a surgical procedure, right? You might go there, you needed a surgical procedure, you cut the skin again, the same thing. Because you have opened the skin, you have opened blood vessels, so the bacteria is around here, they can get into that incision site or the wound, and then they get into the bloodstream. Or you have a wound, ulienda ukagonga huko kidole ukitembea. No, that wound, because of the pus, and when you see pus, that means a bacteria, and there's some fighting there. So because it's a wound and it's within the tissues, again, there are some blood vessels that are open. There are very tiny ones and even bigger ones. So those bacteria in that wound can also get access into the bloodstream. Then they get to the blood, and then we end up with a blood infection. Now, the other common ways or common routes to which you can get now blood infection, which are the ones that now you mentioned, like pneumonia. Pneumonia is affecting the respiratory system, right? You start coughing, you get your bacteria there. A common one, Streptococcus pneumoniae, which usually causes most of the time causes pneumonia. Now, as I said, when you get pneumonia, for example, or a respiratory tract infection, the body again usually mounts a way of controlling it, try to contain it there, right? Most of the time, the body can contain it, and then you get recovery. Sometimes you get your body not able to contain it now within the respiratory system, which is now the airway and the lungs. So if it remains there, it's okay. But sometimes the infection will be too serious, or can get out of the respiratory system. And how does it get into the respiratory system? Remember, the respiratory system also has blood flow. The lungs have a lot of blood flow going in there. So this infection there, or this bacteria causing the pneumonia there, they can find their way into the bloodstream. Now, they get the bloodstream, this bacteria get the bloodstream, when they multiply to a certain number, or a good number gets into the bloodstream, then again, you end up with the blood infection. That's why I was saying, you might have another disease somewhere here, then it ends up in blood. So that's how now the respiratory system affected can move from the respiratory system per se, then it gets into the blood. Then you get blood infection. So you'll be having two things at the same time. You have pneumonia and you have blood infection, because the infection has not been contained within the respiratory system. Now, as I said again, the other system that is common or that can commonly lead to blood infection when it's infected is the gastrointestinal system. You mentioned the stomach. For us, we call it the GS because it's a system. The stomach is just one part
Of the
entire system,
Yeah.
starting from the mouth. So the mouth, the esophagus, the stomach, the intestines.
Yeah.
So sometimes you can get the GI infection, ama infection, and GI chakula, let me call it that way. And many times you have gone to the hospital with the same. Unauma na tumbo, unatapika, unaendesha, maybe you're having typhoid, you're having amoebiasis, all those things. And those are the things that we end up causing the same. So again, you find that the GIT, the system ya chakula, including now the stomach, again, it's supplied by blood, a lot of blood. Reason being very simple. You eat, the food is digested, it needs to be picked from the system, it will go through the blood to the other parts of the body where it's needed, the energy is needed, and to be stored where it needs to be stored. So what will happen is, if now you have a bacteria now within the system, which are overwhelming, of course. I said we have normal flora. Our gut has bacteria. But these bacteria are usually maintained between certain ranges. So if anything that's going to happen to tooth, maybe you now ingest food that has more bacteria because of those toxins and that. And remember, you have now the infection. You get what we call inflammation. So when you get inflammation in a area that already has a lot of blood flow, ni kama ugonge hapa. So unaona ukigonga hapa kidogo unakuwa red. What does that mean? There is some inflammation. So there is more blood now coming there to fight and take back that area into normal. So the same thing happens to the system. The same thing happens to the, as we'll talk about pneumonia, the GIT, you get infection, the inflammation. So already that area has a lot of blood flow. You cause toxin there, you get infection there, the toxins trigger the inflammation. Now the blood flow inakuwa mingi sana pale. So the bacteria can now easily penya into the blood. So zinaingia kwa damu. Zikiingia kwa damu, they cause again blood infection. You see how now they are connected? Now, the other system that is again commonly affected and leads to blood infection is the urinary tract. A lot of times you have gone to the hospital and ukona UTI. That's urinary tract infection. Again, urinary tract infection can, the severity also matters, the level also matters, and they're different. You can have the UTI affecting just this lower part of the system, that's the urethra, what we call urethritis. You can have it affecting the bladder, what we call cystitis. You can have it affecting the ureters, what we call urethritis. Or you can have it affecting now the entire system, including the kidneys, what we call pyelonephritis. Now, again, the kidney usually receives a lot of blood every day because it cleans blood. It filters impurities from blood. So anytime you're going to have an infection around the urinary tract, again, it can easily get into the blood and spread to the blood and become now blood infection. So you will be, again, you'll be having a kidney infection or a urinary tract infection. Then you also have blood infection. Now, the other common way you can get this septicemia or blood infection is when you do certain procedures, the dental procedures, for example. You've had an infected tooth, or unangoa jino, then kunakuwa na infection pale. So ile unangoa jino, again, you're opening blood vessels. And you remember the mouth has a lot of bacteria. So they get a chance to get into the bloodstream. Again, you end up with a blood infection. Yes. So basically, you'll find you have something else somewhere that is now the infection has not been contained in that specific system. Now it is going out into the blood. So you'll be having two things at the same time. You know, I was just about to ask about the risk factors after this, but after what you've explained, all I can say is let's just take care of ourselves. Because any bacteria in any part of the body would lead to having a blood infection. You know, I shared this some time ago, 2 years ago. I was admitted for blood infection. But then by then, nile to one kana blood infection, unatreatiwa, and that's it. So after some time, I now start hearing about people mentioning about blood infection. But as I said, and I said this before we started, is that I think we don't talk about this enough. But it's something we're supposed to talk about enough because, as you said, is that it's a complication. And we'll be talking about how bad would it be. We can have a blood infection and it's not treated. We assume to, I'll just take care of it at home. How bad would it be? But before we get there, I'd love for us to get the vox pops because I'd love to know, tuko wapi na history of blood infection? Do we know enough?
Do we need to do more sensitization about the same? Maybe we'd get a whole month that we're talking about this, you know, like this month is Breast Cancer Awareness Month. Maybe we'd need to have a whole month where we talk about this is what you're supposed to do for you to take care of your body, because that's very important. But for now, let's get the vox pops and then we come.
From what I think, maybe kama mtu akona other problems za mwili, akue on medication for so long, inaweza cause blood infection because of the drugs zenye ana consume.
Infection moja mara mingi tunaambiaga tukue watii, ama mtu mwenye anajielewa mambo ya ukahamba na nini vitu kama hizo, sababu unajua sinaleta kama shida kama hiyo. Juu saa zile unaenda sasa ndoa nje na nini, na wezi juu ya mtu akona shida gani, sinaona automatic unapata hiyo shida. Vitu zingine ni vizi kama unaweza shika vitu kama mishumali, mawembe, wezi juu ilikuwa imekata nani, vitu kama hizo. Na ndio naona most of time kama ni madaktari, hata ukienda kutimbiwa, huwezi timbiwa na shindano yenye imetibu mtu mwingine. Lazima uwekewe yako, utibiwe na yako, akisha kutibu anatupa. Sababu najua mbeleni kitambo kabisa enzi yetu tulikuwa tunatibiwa kwa shindano, hata inatibu watu kama ni 20. Na ndio alikuwa ukidungwa shindano anaichemusha. Na sijui kama wewe ikutilia hiyo. Inachemushwa, inadunga mwingine. Lakini kulingana na vile sasa watu wameendelea kukua civilized, kila mtu anatumia yake. Ukisha injectwa ina dispose, inatupwa. Mambo ingine ni kuhusu chakula. Inasemekana sana hizi chakula most of like za fringe hazikuwa kisu mzuri.
Blood infection mostly naona ni kama sisi wanawake ama wanaume kubadilishana kimapenzi. Sana unaweza kuchanganya damu kama mwanamke, niko na wanaume wengi, na mwanaume ako na wanawake wengi. So inaweza cause that blood infection.
All right, so that is what you know about blood infection. Is there anything you'd want to add, correct, remove?
I don't want to correct, I don't want to add or remove, but I want to mention that at least people are aware.
Yeah.
They seem to have an idea of what blood infection is and what can lead to blood infection.
Yeah.
And if you follow what they have said, it's just what you have said. If you're not taking care of yourself, you can have you can easily have an infection getting into a system.
Yeah.
So anything that you're going to do that is going to put you at risk of getting an infection, then you risk getting a blood infection at the end of the day.
Yeah.
Yes.
Perfect. Now let's talk about the risk factors. Najua tumiongelea in what you've been talking about, but let's just list it so that you know where are you with it. Are you safe or do you need to do better?
Now, the risk factors that we can list, there are several of them.
Yeah.
And they basically is what will make your infection, or not your immunity weak. There are several things that you make your immunity weak.
Yeah.
Some are natural, others are not natural.
Yeah.
For example, when I talk about natural is age. We all know that when you are young, or during the infancy stage, children less than 1 year, the immunity is not fully developed.
Yeah.
That's what I'm talking natural. So they are more risky. The same, and for the same reason, I usually recommend that anybody who has a child who is less than 1 year and they are sick, don't try to treat them at home. I usually insist, even if you call me and tell me niko na mtoto wa mwaka moja ama miezi 8 anakoa anatapika, naweza mpatia dawa gani? No.
Let hospital.
Why?
Yeah.
Because when the child gets there, the assessment will be done, the severity of the condition will be established, and then appropriate medication or appropriate treatment can be initiated. Because of the same thing that you're talking about, this septicemia can complicate, right? And when it complicates now, it becomes, which you're going to talk about, when the complication becomes a totally different thing, and the approach becomes very different. So this child who is less than 1 year, they don't have enough immunity, so the immunity is low. So they are at more risk of getting septicemia, And that's why you find that even if you go to the hospital right now, the pediatric ward is full as compared to the other wards. Yeah, it's because of the same reason that they are more prone to septicemia than any other person. It is because their body cannot contain, or they are not able to contain the infection in specific systems.
Okay.
Number two of category in terms of age, that are people who are at risk are people who are above 65 years. Again, for the same reason, as you grow old after 65 years, your immunity again gets inaenda chini. So you are at risk of getting serious infections, or you are at risk of getting septicemia, because again your body is not able to fight infections appropriately. Then from that categories, we go to the other category of people who are at risk, and again generally talk about reduced immunity. We talk about people who have chronic diseases, people who have like diabetes. We know diabetes usually lowers, usually lowers the immunity. So those people are at least risk of getting this kind of infections. There are also other people who have chronic diseases like chronic respiratory system, for example, what you call COPD, or chronic obstructive pulmonary disease. Again, they are prone to recurrent infections of respiratory system. So the same thing, because they recur to more episodes of recurrent respiratory infections, that now makes them susceptible to developing septicemia. Of course, there are other people who have HIV. Of course, we know HIV is immunosuppression. So those people have immunity which has been suppressed. So again, they are more likely to get septicemia and this blood infection talking about. Then the other group of people, there are people who are using what we call immunosuppressants. There are drugs that we use that can reduce immunity. We categorize them as glucocorticoids. So when I say glucocorticoids, anybody in the medical field will understand what I'm talking about. So if you use them for over a long time, then they lower the immunity. There are some situations whereby you must use them because of several reasons. But again, you can also find yourself abusing them without knowing. Of course, there are some which can be accessed over the counter, and that's why I usually don't recommend people to get medication over the counter, because there's a dawa which might give you a very good response. Wakati umeimeza a steroid, unaimeza unasikia kesho unaamka kamwili ni kazuri. So every time ukisikia kidogo, so without looking at the repercussions. So it's always good to get a prescription of the medication that you're going to use, because sometimes you can use it immediately, will not have that problem because hutakunywa leo kesho immunity iko chini, but if you take it over time, then it lowers your immunity. So by the time now utapata infection, your body not be able to fight, because you have suppressed the immunity, because that's what they do. The glucocorticoids usually suppress the immunity. So the response is not as active as for example, some drugs we use for to moderate immune response in terms of allergic reactions. Allergic response to, for example, I'll give a good example, asthma, right? If you have asthma, because asthma usually manifests as exaggerated response to allergies. So there's some dawa tutakupatia ya kusuppress. So if you abuse those category of drugs, then your immunity goes down.
Now, apart from the one that you've mentioned about asthma, and for that, really, for people with asthma, they just have to use it when they get the attack. But what are some of the other drugs that would, suppress your immunity? The
other drugs are, of course, most of them. The reason I say asthma is because I know those are the ones that most people are likely to get to over the counter. The other ones are you're not likely to get them over the counter because, for example, if you're having a cancer, there are some drugs that are going to be used to suppress your growth. They are immunosuppressive at the same time. So most of the other drugs you find them you're given in hospitals. But again, because your doctor will be knowing what they're giving you and what to expect, they, of course, will explain to you and they will be monitoring you closely. Because, for example, if you have cancer that you're being given what we call chemotherapy, which usually lowers the immunity, your doctor will always be monitoring your toxicity levels and your immunity and how you are. So, atakuwa keen. The over-the-counter ones that you can easily access, they're the ones that I'm talking about. But the other things that can cause, and again, the cancers themselves, they're immunosuppressive. They will affect the immunity of the body. So those are some of the things that will lower your immunity. Basically, things that will lower your immunity. They are going to make you susceptible to septicemia. Okay.
I hear you. Now let's talk about what are some of the symptoms or the warning signs. Something that you'd see and immediately you'd know this is not only any other kind of infection, sasa hii imekuwa blood infection.
Yeah, clinically or symptomatically, what you can start feeling, of course, you've been coughing, you've been having kuchungu kidogo kikojoa, that's a UTI, then you all of a sudden you start having fever. Yeah, the fever is not it's out of now control.
Yeah.
That is one thing. When the fever starts to spike.
Yeah.
Number two, you can have what we call now the chills. Mtu anakuambia nasikia joto lakini natetemeka.
Yeah.
Nasikia joto lakini
unatetemeka.
Somebody is shaking. Ukiwanguza, they are very hot. Those are chills. That is another thing that can tell you that you're likely to be getting into sepsis. The blood infection that we are talking about. And now, of course, when you go to the hospital, maybe they would check your blood pressure. The blood pressure will be going down. And the other very common thing, like now, the general body weakness. Unasikia tu mwili imeisha. Imeisha nguvu. Those are some the key things: fever, chills, then general body weakness. Those are very key. You start feeling those when you've been coughing and you now unasikia joto, chills, hiyo mwili imeisha nguvu. Then start thinking about this thing might now be moving out of the chest, or maybe from the stomach, or maybe from the kidneys, and it's getting into the bloodstream. That's why the response usually makes your body feel weak, and that's why I usually tell people, you have chills, you have general body weakness, you have fever, it's not always malaria. Because that's what they tell us. They come to us and tell you,
niko na malaria.
Daktari, niko na malaria iko juu.
Yeah.
But because the definition of malaria is those things. Chills, fever, general body weakness. So those are symptoms that can also be manifesting as other conditions. So ukienda kwa daktari usimwambia ile malaria niko nayo, lazima ni last time kwa hivi nilikuwa na malaria. So
hata sasa niko na malaria.
Hata niko na malaria.
It could be something else.
How
would you know that this is a mild infection and this is now becoming systemic?
Now the mild one is that you have a pneumonia, or you're having a cough, or you're having a UTI, and you're okay. Your body is still a bit strong, you can move about. Right? That's why I said when you start now feeling the fever, the chills, the general body weakness, now you're getting serious. Now, the serious, if now it flips to the other side. Now the complication of blood infection, what I was talking about now, the sepsis itself, what we now refer to as sepsis, now it's a very serious thing. Because now you get to, somebody has been having these symptoms, then they start getting what we call altered mental state. Confusion. Mtu anaanza kuwa ni kama network inapotea. That is a person who should be in hospital ASAP. Right? Usikae na mtu mwenye alikuwa nakohoa, then joto kidogo, then unaanza kuona ni kama ako tu. Network inapotea. Kimbiza hospitali. That is getting serious. Yes. Now when you get now to hospital, now the what we call now the signs, the doctor will look at you, they will examine you, then they find that you have now the hypotension, blood pressure, inashuka. Then when they touch your skin, it feels clumsy, right? Now, then the pulse rate usually tends to go very high because of trying to the compensation mechanism. Now the doctor will tell you, now this one is very serious. And now the problem now with that, now the sepsis is damaging the other organs, right? Because once the blood pressure goes down, the other organs will not be getting enough blood flow, then they start to fail. And then you might end up with what we call systemic organ failure, or multiple organ failure, which is now a very serious one. You might even find yourself ending up in ICU because of that.
So it can be really serious.
That's how serious it can get. Yes, sepsis can get, septicemia or blood infection can get to sepsis. Sepsis is a very serious complication of the same, and that can land you into a very serious problem. Because now once there are several organs fail, we're talking about several organs, we're talking about the kidneys, we're talking about the liver, we're talking about the heart. Once those fail, you are in a critical condition. Yes, that's how serious sepsis can be, or now the septicemia. And now it gets to that level, now we'll not even call it septicemia. Now we call it sepsis medically. Yes.
So that means the moment you start feeling the very mild symptoms, just go get checked to make sure that you're okay. Most of the time we talk about people doing self-treatment and self-diagnosis with Dr. Google and nowadays ChatGPT, asking, I'm feeling this and this and this, what could it be? Na siku hizi wamekombaka wajanja, they'll even tell you what to use. go buy these, and you'll be okay. So what you're saying is, if you feel anything that is off your normal, go get checked.
Yeah, I would highly recommend that. And I usually say, you mentioned Google, and I was smiling because I've had episodes, I've had encounters with the Google. Google is not bad, right?
Yeah.
It's not bad to be informed. I usually encourage people, and that's what I usually do. As I'm offering my services, I also educate people. And the reason I will educate you and tell you you have blood infection and not leave it at there. I'll tell you have blood infection because of this and this and this, because I want you to be informed. I don't want you to be confused up inje na myths that are around here because I've seen the consequences of that. So I'll tell you have this, and this is the reason for this, and I'm going to treat you like this. Then this is what we expect as the outcome, so that anything that deviates from what we're expecting, then you come back, we try to see where we can adjust. Google will tell you a lot of information. But this information is usually so general. And most of those searches, what you find, at the end of the day, they'll tell you, consult with your doctor.
Yep.
They know.
Yeah.
Because I always tell people, when I went to medical school and we started learning about medical conditions like pneumonia, malaria. Mukienda class hiyo siku msome pneumonia, ukitoka hapo unaanza kukohoa. You start feeling those symptoms. Kesho mnakuja mnasoma malaria, unaanza kusikia joint pains. Unaanza kusikia fever.
It's very true. It's
because
very
it's something, the mind is a very powerful tool. So you feed it. So when you're doing the search, you get those symptoms, then you start kusikiza ni kama nasikia hivyo. And the mind is usually engineered to go for the worst. You not go for the mild ones. You go for the major things. I've seen a lot of people coming to me even for scans. Someone tells you, daktari hakuna cancer. Like what you're presenting with and what I'm finding out, I'm even wondering how did it come. So when I dig deeper, either they Google or they had somebody close who had the same problem. So they're relating the problems with the other person with themselves. And it becomes a major issue. So with the blood infection, because of the complication that can arise, we usually say that timely treatment is really key. That's why, as you said, you feel you're not okay, if something is not working, your health is your wealth, visit the hospital, get checked. If it's something that can be treated, if it's, for example, blood infection, we'll give you antibiotics, for example, and then you'll be okay. We will not have to get to the sepsis, because once we get to the sepsis now, things are going to get out of hand. And that has been said many times. Ukipeleka mtoto naambiwa, hey, mtoto, ndio akona hii na hii, lakini akona blood infection. Unaona? And the reason, most of the time, you'll be told mtoto anahitaji kuadmitiwa. Unaona? The same thing. You can come as an adult and take your history, I do your examination, and I'll tell you, from what I'm doing, I've done some, run some lab tests or lab works, and I'll tell you, this one, we need to treat it in the ward. Why? The reason is very simple. So sometimes there usually a lot of resistance when you hear admission. Of course, we know you'll be missing your home, you'll be missing your comfort of your family, all that. We agree. But the reason we are telling you this is because we want to put you here, put you on treatment, and put you on close monitoring, because we know if we slide to sepsis, it becomes even more complicated, becomes more dangerous, and the worst of sepsis is shock, what we call septic shock. You get shock because of infection. All the systems are shutting down.
How does that happen?
The same thing I was telling you, that you have a serious infection, it gets worse, sepsis, organs, they fail, then you get what we call septic shock. Yes.
So we really need to take care of our bodies. I love that you've mentioned and said that your health is your wealth. Sometimes, we've had these conversations and people say, checkups are really expensive. Consultations usually how much, but really your health is your wealth. If you don't go get checked, and the next minute you have to go to a hospital and get admitted, you lose more money than you had to use
Exactly. As we've said, that's how I like to explain to people. You'll finya 500, I'm a 1,000, I'm a 2,000. Then now I'll give you like assuming now somebody has come with pneumonia, for example, then you delay to go to hospital. You will have gone to hospital or get for consultation, you pay your 1,000 or 2,000 for consultation or 3,000. Then you get medication of 1,000, 4,000, for example. Then you don't do that. You wait until you get to sepsis. You know what will going to happen? You will still come to hospital. You still pay the same consultation. You still do the lab works. In fact, initially you might not have been able to do the lab works. Now you need to do the lab works. Then you will be admitted. Yeah, admission itself. Not forget about the amount of money that you're going to pay in hospital. I like putting it this way: you're admitted for 3 days.
Yeah.
What do you usually do as a person? Maybe when you're mkulima. Ulikuwa unaenda kupanda sukuma zako ama nyanya zako hiyo siku ambazo in the next 2 months they would have given you 100,000. Hiyo siku 3 hujaenda kupanda. How much have you lost? Your 100k is gone.
100,000.
Yeah, because of like 4k or 3k or 2k or even 1k. See, so when you look at it that way, then you realize now health is wealth. Because when you're okay,
you're able to do everything else that you need.
So you're able to make more money. But you wait until things are worse, then ila ile kidogo ulikuwa na save,
you're not able to.
Exactly.
Okay. Now what I'd encourage all of us to do is that if you, even as we continue with this conversation, if you know how uko sawa, please go get checked. That is why we have these conversations each and every other Wednesday, so that you're able to know this is not normal. You need to go get checked. All right, so this is MPCI TV ambapo tunabadilisha maisha by the grace of God. I see we have feedbacks coming in already. Thank you so much for your feedbacks. As we come back, we'll be reading your questions, but also we'll be looking at some of the myths that are around blood infection. Yeah, so I'd love to hear from you. What is something that you've heard about blood infection or any other thing that causes blood infection? Because now we've heard that blood infection is secondary. It's that there's a primary disease. It could be the stomach infection, as you've been told. It could be anything else. So what have you heard about that? And unajua, this is not right. So this is where we demystify. But for now, we'll be taking a very short break. This is Afya Clinic. Today we're talking about blood infection, and my name is Rachel Kahogo.
MBCI Television, transforming life.
Kenya,
arise, arise!
It's time to catch the fire of repentance revival with missionary pastor Robert Kalansi from Australia.
Every demon in the land, every principality over this nation shall bow to the name above all names.
Come worship with us as we call forth Kenya's revival. Dates: Friday 24th October from 3 p.m. to 8 p.m. and on Saturday the 25th of October at 9 a.m. Venue: Western Hotel, Langata Road, Nairobi, Kenya. This 2-day conference will be climaxed by a powerful water baptism service on Saturday 24th at the same venue. For the kingdom is the Lord, and he rules over the nations. Psalms chapter 22 verses 28. Come and be part of a powerful move of God in this prophetic end time hour. Follow us live on Robert Clancy's pages on YouTube and Facebook. YouTube, Repentance Revival. Facebook, Repentance Revival with Robert Clancy. For more information, call 0712 477 334. Visit us at www.repentancerevival.com.
He is calling the eagles from the east, from the south, from the west, from the north.
The meetings are absolutely free and open to all.
Yesu kwetu ni rafiki
siku zote duniani.
Lia kuikwikwi, lia kuikwikwi, kuloa.
Shut up everybody, listen.
Tititi. Kuna hizi sauti za kimadende, hebu nitolee tu kidogo.
It's about to go down.
Kulu 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 kulu.
Rudia tena.
Kulu 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 kulu.
Mount Everest iko kwa bodea Tanzania na gani?
Hey y'all, come look at this.
Egypt.
Come on here, babe, go.
Bluetooth inaitwaje kwa Kiswahili?
Meno ya buru.
Unataka kuambia mtu kwa kizungu kutangulia si kufika, utamwambiaje kwa kizungu?
Starting is not a writing.
What?
Beginning is not a writing.
The longest chapter kwa Biblia iko kwa kitabu gani?
The longest chapter in the Bible.
Yes.
First First Kings.
What?
And Second Kings.
Do me a favor, please. Get out of here. Get out of here, man.
Tattoo City and the environs. Are you ready? The heavens have opened with blessings beyond measure. It's time to walk in your inheritance. Reverend Peter and Pastor Florence Kamau, senior pastors at the Tattoo Chapel, presents the Inheritance Summit 2025.
I don't know the darkness that is up upon your life, but I want to say that I am. He is rendered to thunder in the name of Jesus.
The conference begins on Wednesday 22nd, Thursday 23rd to Sunday 26th October 2025. Venue Eastern Bypass, Roiro Membli, just 200 meters behind Overstone Hotel, next to Muhen Heights. Theme: Blessings Beyond Measure. Schedule: our meetings begin on Wednesday from 5 p.m. to 8 p.m. and Thursday to Sunday from 9 a.m. to 8 p.m. with guest speakers Bishop Margaret Wangari, Apostle David Juma, Apostle Julia Subi, Evangelist Lucy Wangonjiri, Bishop Thomas Muthe, Pastor Micah Motune, and Apostle Tim Wangi. Music by Tattoo Chapel. Come expectant for mighty move of God, impartation, healing, deliverance, and divine encounters. Your time is now.
MBCI Television, transforming lives.
All right, you're back. Thank you so much for staying. This is MBCI TV ambapo tunabadilisha maisha by the grace of God. It's such an honor to be here and to have you on board. Thank you so much for choosing to watch MBCI TV. We do value your time greatly. We are live on MBCI TV. We are live on MBCI TV official YouTube page. We are live on MBCI TV Facebook page. And of course, on all those three platforms, you're able to get us. You can comment on the comment section on Facebook and YouTube, and you'll be able to get your feedback. Of course, if you'd love to ask any question, our WhatsApp number is also very open. That is 0721 105 105. Our SMS code, which is absolutely free of charge, it's 23813 or 23814 rather, and we'll be able to get all your feedback. Now, today we're talking about blood infection, and we've been able to unpack and just be able to know what exactly is blood infection, how does it happen, what are the complications of blood infection. And I'm here with Dr. Steve. Thank you so much for being here from ClearScan Medical Solutions. Tell us just a bit about ClearScan Medical Solutions.
ClearScan Medical Solutions, there's a lot that can be said, but you said I say just a bit.
Yeah, just a bit.
We are a medical clinic located at the Arcade Building, for Kenyatta Avenue, opposite Equity Bank.
Yeah.
Here we do general consultations. We also do medical diagnostic ultrasounds. And of course, when you talk about ultrasounds, we're talking about a whole range of scans.
Yeah.
Of course, abdominal, pelvic scans, prostate scans, pregnancy scans. You talked about pregnancy and infancy wellness. And that's where now ultrasound comes very handy in terms of taking care of monitoring your pregnancy. We really really doing something about it. And then of course breast ultrasound, which I have to mention, because again we said this a month we are talking about the breast cancer, and we have an offer, by the way, for the entire of this month. Imebaki wiki moja mwezi uishe.
Imagine.
Yeah, we're doing it at a reduced price because we know the importance of the breast ultrasound. We're also doing echocardiograms, where we are talking about the health of the heart, and we also are doing a cardiac clinic at ClearScan Medical Solutions. Yes.
So it's a wholesome place. You'll get everything that you need.
Yeah, exactly.
Okay, I love it. Now, because today we're talking about blood infection, I had asked that we get some of the myths that surrounds blood infection. But in your line of duty, what are some, maybe you can mention one or two, some of the myths that you've really had people talking about?
Not to add a lot of myths when it comes to blood infection, because as I said, it's a bit of it's not a straightforward conditions, and I don't think I have ever heard of any. I can't even remember any that I've heard about the blood infection, because maybe they will have myths about the other conditions that now might lead to blood infection. Yeah.
Okay. Perfect. Let's look at some of the mythbusters that we have, so that Doc can also be able to demystify and tell us, is this actually a myth or not? And you have the first one that says that only people with weak immune system get blood infections. Is it true?
It's not only those with the weak immunity. That is not true. Anybody can get blood infection, as I explained. It's only that it will be more common for people who have weak immunity.
Yeah. All right. And then the second one is that blood infections only happen after surgery or major injuries.
Again, that is not true. As I said, anybody can get blood infections. It's only that, remember, this is one of the risk factors we talked about, or predisposing factors. We talked about injuries or pricks, and that can happen in hospitals, and surgeries being a contributing factor, or being able to lead to blood infection.
Okay. And the third one is that blood infections always show clear symptoms right away.
That's not true, because sometimes you get blood infection and you'd not even realize that you have a blood infection. The body is able to take care of it before it gets into the to the symptomatic stage. And again, it is not straight, because, as I said, you could be having it as a complication of pneumonia. So that is not clear. You think that you have pneumonia, could be it has gone to the blood, or you have a UTI, it could be it has gone to the blood. So it's not straightforward.
Okay.
Yeah.
Okay. And the other one is that you can treat sepsis at home. Can you?
Sepsis you cannot treat at home, because remember I said sepsis is a complication, or is an advanced stage of septicemia, which you might need a lot of monitoring, so you cannot treat it at home. You need to be admitted, given the treatment, the proper treatment that you need, at the same time being monitored, so that you don't get into the worst complication of the sepsis, that is now septic shock. So you cannot treat it at home.
Okay. Watu wanapenda sana kukua na home treatment. Starehe. All right. And the other one is that if you're taking antibiotics, you can't get a blood infection.
That is not true. Sometimes you've put people on antibiotics, and you find that the bug that you are trying to eat with that antibiotic, it is not responding to it. So instead of person getting better, they are getting worse. So if you are not able to eat it the way you are supposed to eat, or with the right medication, you can get sepsis or septicemia when you're still on antibiotics. And now, when you go back to the daktari, then atakwambia, we have been giving you this antibiotic and it seems like it is not working. We might need to change to this. Or you're treating the septicemia caused by bacteria, could be it's being caused by a virus. So you can still be on antibiotics, and if you get a viral infection, which can cause septicemia, you'll still be sick. So not all the septicemia are treated with antibiotics. If it's viral, the antibiotics will not work. If it's protozoal, the antibiotics won't work. If it's a fungal, then again, the antibiotics will not work.
Okay.
Yes.
Interesting. So you have to go to hospital.
Yes. It's important.
You can't just treat it at home and say that me on antibiotics, I'm good to go.
We have seen people getting worse. That's what we usually review. Especially watoto. You've been talking about you give your treatment for 12 hours, you review, 24 hours, you review. If nothing has changed, you have now review your treatment plan. You have to change everything and now come up with a new treatment plan. Yes.
Because I've had people saying, sikuwa na feel vizuri, so nilienda hospitali, or rather to a chemist, and I got antibiotics and I'm feeling better.
It's only in Kenya.
It's only in Kenya. In fact, maybe we should talk about that. Is it okay for people to self-prescribe antibiotics?
It is not right. There was a show you had sometimes last year of drug resistance. Yes. Now, that is what we are brewing. And with time, it's going to catch up with us. Because every time you cough, you have a running nose, antibiotics. It's a viral infection, but you're taking antibiotics. Your body is going to get used to it. So by the time that you need that antibiotic and try to use it, it will not work. Yes, that's now the problem is. And now the same thing that can lead to what we are talking about. You now have a serious infection, we try to treat you, it's not working. So it gets out of hand, you get septicemia. Then you're asking yourself, what is happening? Now we need to get your blood and do blood culture, know what bug is now disturbing us here, and then now get exact drug that is now going to work for you. Antibiotic resistance is a real thing, and we are brewing it very seriously because of that aspect of nikikunywa haka kadawa nasikianga vizuri. So you have known, ama mtu anakuambia unasikia tu sore throat, enda ukunywe antibiotic ama enda udungwe hii sindano. You need to have a proper diagnosis. That's what we'll insist on. In fact, many times you come to me and I'll tell you I'm not going to prescribe for you anything. Yes. Then you are like, daktari but nasikia vibaya. I will explain to you what is your problem. If it doesn't need antibiotics, don't need antibiotics. Then you find somebody who has gone to many places, so many medication ametumia. But the problem is not it's not to the antibiotics thing that they cannot be solved by antibiotics. Why are you taking antibiotics? So
you're just creating the resistance.
Exactly. That's why I usually say go to somewhere where you'll be taken care of holistically. Remember, health is not just pain or absence of pain. No. Health is a psychological aspect. In fact, most of the people, 75%, people I usually say is psychological. Listen to them. Take a good history, see what the problem is. Because some psychological problems will manifest as diseases or will manifest like, inaweza manifest kama pneumonia. Kwanza mtu anaweza kuja kama akona asthmatic attack. And then this person is not having anything related to antibiotics. Then you are pumping antibiotics. You're using antibiotics.
So you need to check them very well.
Exactly.
And we'll be talking about that at the end because that's very important. The psychological part of it. But now let's talk about the treatment and management. How is blood infection treated or managed? Are you able to do you need to only manage it or you have to actually treat it?
Now, when it comes to management, when you talk about management, it involves a lot of things. It involves now the psychological support, it includes nutrition, it includes now the drugs or medication. All those things are involved. But when it comes to the blood infection, of course, blood infections needs to be treated. And the treatment now will be based on what is causing the blood infection. You have said most of them are bacterial, right? So you'll be given antibiotics, and depending on how the severity of the infection, so you might be given some oral medication you take at home. If it's severe, you might be admitted for several days. You're given the IV medication, and maybe the doctor, if he deems that you need that close monitoring so that you don't get into the worst complication of the same, then you might be put in the ward. You'll be put in medication, monitoring, and then after that, you'll be allowed to go home. But the good thing is that it is treatable. Yes, if you get it early and on time. Yes, that is the key word. On time.
Now that you're talking about early intervention, what is the importance of early intervention? You talked about being able to catch it early and treat it very well. Would there be a difference? Maybe just speak about two people who'd come and you're able to realize any blood infection. And another one, mwenye atakuja ikiwa sasa imefika sepsis.
Now, when you come early, it means that the number of the organisms that are causing this problem, be it bacteria or be it virus, let's talk about bacteria because the most common, the number is less. Right? So the response to treatment will be a bit faster. Remember, you are killing these bacteria, for example. You give you antibiotics, you are killing them, right? So if you have like 100 and you want to kill 100, it is not the same when you have 100,000 but somebody who has 100. If you have 100 and you need to kill 100, it's easy work.
It's easy.
If you have 100,000, it is not as easy as 100. Then, as I said, the other thing is that the body, with the way the body reacts, if you have now, it's early, the response is minimal, right? The body is not going to put a lot of effort to fight, right? So you have less a risk of getting to the multisystemic organ failure or the complication of the sepsis. So the risk of getting to that stage is lower. If you come late, as much as you're going to start you on treatment, the body has already mounted this immune response, which is on the high level, and now we can head up with the organ failure. So that's the difference. If you come early, the better. The response is minimal. The treatment is a bit easier. When you come late, you risk getting the high response, which now can complicate to sepsis. Yes.
I see you have Victor here, and he's asking, can someone fully recover from a severe blood infection?
Yes, people recover. With the proper treatment, interventions, yes, people recover from blood infections. Yes, it's treatable.
And that's hope right there. All right, Esther is asking, Are there long-term complications even after treatment?
Long-term complications, unless it was caught too late, yeah, and we had reached that stage of systemic organ damage.
Yeah.
So those damages, some of the organs, once they are damaged, it's not easy to reverse them back to where they are supposed to be. They might recover, yes, but they might not go back to 100% where they are supposed to be. And that's why we are saying early treatment, so that we don't get to organ damage. Yes. So there could be, but now that would be depend on case by case. Yes.
Okay. I hear you. Now, we'll be looking at some of the other questions that you've sent, but for now I'd love for us to get a very important segment. And this segment is healthy living. It helps us to just understand how would you be able to live a healthy life, because that's very important. And it has been prepared by the one and only Sylvia Wanja.
Hello and welcome to Healthy Living, where we empower you with the knowledge to live a healthier and safer life. Today, we are talking about blood infection, medically known as sepsis, a silent killer that many people ignore until it's too late. What is a blood infection? A blood infection happens when bacteria, viruses, or fungi enter the bloodstream and begin spreading throughout the body. Once this happens, the immune system reacts aggressively, causing inflammation across different organs. If not treated early, it can lead to organ failure, shock, and even death. Many people assume sepsis only affects the very sick, but it can affect anyone, including healthy individuals, especially after a wound or injury, surgery, childbirth, urinary tract infection, pneumonia, untreated skin infection or dental infection, etc. Early warning signs include 1. Persistent high fever or very low temperature. 2. Fast beat or rapid breathing. Confusion or disorientation. 4. Extreme weakness or unusual tiredness. 5. Chills and shivering. 6. Severe pain or discomfort. 7. Pale, clammy or blotchy skin. If a person just doesn't feel right and symptoms are getting worse quickly, that may be sepsis. Who is at higher risk? While anyone can get sepsis, the risk is higher for newborn babies, pregnant and postpartum mothers, people living with diabetes, people with weak immunity, that is, with HIV, under cancer treatment or steroid use, the elderly, people with untreated infections or wounds. The early treatment is crucial. Sepsis is a medical emergency that the earlier you seek treatment, the greater the chances of survival. Doctors treat it using strong antibiotics, fluids, or organ support. Delaying treatment increases the risk of kidney failure, lung failure, heart complications, amputation, death. The motto is don't wait, treat infection early. Prevention tips include treat infections early, don't ignore recurring fever or pain, keep wounds clean, that is, wash and dress cuts or burns immediately, complete your medication, especially antibiotic, as prescribed, practice good hygiene, that is regular hand washing, and also safe delivery and clean postpartum care. Mothers and newborns must be monitored closely, and also vaccination. Reduce infections that can lead to sepsis. When should you go to the hospital immediately? Rush to the hospital if you have an infection plus fever and breathing difficulty, you or your child becomes unusually sleepy or confused, symptoms worsen within a short time, a wound becomes swollen, smelly, or produces pus. In sepsis, every hour counts. Blood infection is preventable, but only if caught early. Take infection seriously, seek medical care promptly, and look out for warning signs, especially in infants, new mothers, the elderly, and anyone unwell with fever. Your health is your greatest investment. Protect it. Thank you for watching Healthy Living. Stay safe, stay informed, and see you in the next episode.
All right, you're back. Thank you so much for that amazing segment. And I know that you've gotten to learn a thing or two from that segment. Now, it has been like a collection of what you talked about. And from that, there's a question that has come up. And this is a very interesting question. You see how people say for you to have good eyesight, ukule carrots. You know, for you to make sure that your immunity equals sour, make sure you take a lot of greens and all that. Now, there's this question. What lifestyle hack would you employ to make sure that you do not get blood infection?
You do not get?
Yes.
I do not get might be a bit hard because we say this can get anybody, including people who are very healthy. But generally, taking care of yourself in terms of hygiene, it's going to help you prevent those issues. And the way you're handling your food, hand washing, brushing your teeth every day, because remember, we have mentioned oral health several times in these terms when we talk about blood infection. So oral hygiene, hand hygiene, which is very important, and of course, healthy living, eating healthy. Because we have said generally, it will be more common for people whose immunity is low. Not like, we know there are people who wanakuja wanakuambia mimi, I don't eat. I don't take snacks. Where are you going to get these other components that you need? The fruits component, the vegetable component, and you know, generally vegetables and fruits, they are very good with the vitamins, and these vitamins are the ones that are going to help improve our immunity. And of course, exercise. It's very good for immunity. So those two things, those three things, just stay healthy. Just stay healthy. That's the hack. Stay healthy. Very important. Maybe, Doc, let me ask, what is a hack for the people who are struggling with the issue of appetite and not eating, you know? Not like they don't like food, but, you know. There's no specific hack, but you look at the foods again. When you come to foods, you need there are foods that are going to help you improve your appetite. And these are fruits and vegetables. And I know people who don't like eating, they also have that problem with the fruits and especially the vegetables. But the more you get, you get to eat them, the better. Because what we usually give for people who have reduced appetite, we give them multivitamins. You give a concoction of what we put in a bottle. Then we tell you this is going to improve your appetite. So if you want to hack it naturally, more fruits. More
fruits and vegetables.
More fruits and vegetables. They're going to help you.
I hear you. I see you have questions coming in, but at this point, we'll be giving your contact so that if anyone you're there, you'd like to consult even more, you'd be able to do that. Just make a call or text, and you'll get help. But maybe the last question we'll be handling is this question where she's asking, what are the simple steps that I can take to prevent infections from spreading into the bloodstream?
Simple steps. It might be a bit hard. Because as we said, you just need to prevent the prevalent infections. Pneumonia. Stay in a well-ventilated area. Don't get close to people who are coughing. When it comes to abscesses, dental caries, all those things, oral health. GI infections, we know most of the time you get infection with the GI or the stomach is through the hands. So keep your hands clean all the time. So basically that. But once the infection is there, now it's the body to take care of that. It's not about you. But again, if you treat it early, if you, for example, you've had a respiratory tract infection, you get to the hospital early enough, you get treated, then the chances of it spreading to the blood in the chin. The same thing with the UTI. You have a UTI, you have the symptoms, get to hospital, the diagnosis will be made, you'll be put on treatment. So the UTI will be treated before it gets into blood. So again, the key thing here is early treatment. Early detection, early treatment. You prevent a blood infection. Yes.
Now let's talk about the support from the community, the friends, the family. And this is to the people who know, I have a friend or I have someone who's having a blood infection. How would they be able to offer the right support for them?
For the general population, they might not be able to pick the blood infection as fast as possible. I remember I have told you, by the time you're getting blood infection, you have had another infection. So the best way is if you are family and somebody is around you and that person does not look well or they look sick. Encourage them to go to the hospital, right? For example, you have your sister in the house has been coughing for 3 days and is coughing seriously. The next thing is, have you gone to the hospital? And if they have not gone to the hospital, kindly, some people are not hospitali. If somebody is having, for example, diarrhea, vomiting, and they're around you, of course, we'll tell you to give them a lot of fluid, give them the fruits, give them food. But if it's you know, sometimes no kwanga na hiyo kawoga, nitakuwa tu sawa. Encourage them to go to the hospital. That is the only thing that you can help with, because now it is this simple infection that will complicate to blood infection. So if we treat the simple infections early, we avoid getting even the blood infections. So that is what you can do among the people who are close to you. When somebody is not well, they are unwell, encourage them to go and get the treatment, the appropriate treatment, that now we don't get to blood infection. Because once we get to blood infection, as we said, and as we had the complications, we don't want to get there.
Okay. So from the conversation that we've had today about blood infection, you've explained what sepsis is. What would be your parting shot?
A parting shot? Take any infection serious. Don't take it lightly. Once you have any kind of infection, you feel unwell, just get to the nearest facility, have the assessment done, get the diagnosis, get treated. That way, you'll avoid blood infections, and you'll avoid all the other complications related to that, including sepsis, septic shock, and death.
All right. Now, your contacts for the people who would want to, visit your facility, get checked, or call for consultation.
They can visit the clinic at Lydia Arcade Building, as I said. It's along Kenyatta Avenue, opposite the Equity Bank. We are there at first floor, room 105. That's where you find Clear Scan Medical Solutions. They can reach me through my phone, which is 0727 365 217.
Maybe take it again.
0727 365 217.
Perfect.
And there's also a page on Facebook, Network Clear Scan, which usually has a lot of information, health information. We share some topics there. We discuss some topics there. We can also visit, and they'll get to learn something about their health.
Yes, sure thing. Thank you so much. That has been such an amazing session. It has been a very educative session, and I do believe that you've learned a thing or two from that. But if you've not been able to catch us from when we started, that was at 8 a.m. and of course we started from 7:35, where we started with some music, really good music, and at 8 we started the conversation, and it has been really wholesome. If you aren't able to catch us at that time, we'll be having Mombi who'll be taking us through, so do not miss out. It's going to be really, really amazing. Once again, thank you so much for that session. It has been very, very educative. Perfect. Thank you so much for being here as well. Now, for now, I'd love for us to get the Did You Know segment. Now, for the Did You Know segment, it helps you to just jog your mind a little bit. We've had such a wholesome conversation, but just to take you out a little bit before we come back for the pointers, I'd love for you to check out these and tell us, did you know that? Let's get the Did You Know segment. Okay, so the Did You Know segment. Did you know that some trees talk to each other through underground networks of fungi that share nutrients and warnings? Did you know that? Did you know that trees actually talk to each other? You attend to the main statement. The trees actually talk to each other through underground networks of fungi that share nutrients and warnings. I would want to know, is any warnings, Gani? But the thing is, trees actually do talk to each other, and they share nutrients, they share warnings. But the thing is, the roots of trees are they go really deep. So maybe that could be true. But how do they talk to each other? Of course, not like how we talk to each other, most definitely, but they do, there's a way, there must be a way. So I'd love for us to just do some more research on that. Did you know that?
No, I did not.
Yeah.
I'm wondering, what are trees talking about?
They're sharing.
What are they?
And what else? But they're actually sharing something.
Yes.
So that's very, very interesting. That's very interesting.
Also the warning part. What are they warning other trees about?
Maybe you cutting trees.
Okay.
And stuff like that. We're going to
we'll do more research.
We'll do more research on that.
Yes.
You look amazing.
Thank you.
Karibu sana.
Thank you so much.
How are you doing?
I'm doing great.
So there's a question that I've asked our doctor today. I'd love to ask you as well. Monday was Mashujaa. Yeah, Mashujaa Day. Did you celebrate?
Yes, I did.
Okay, who was your Shujaa? Who was you celebrating?
My Shuja was Raila Amolo Odinga. Yes, I was just looking at his achievements and how we are enjoying so many things that he fought for, especially when it comes to freedom of speech. Yeah.
Especially that.
Especially that.
Yeah.
Yeah.
Okay, that's very interesting.
Yeah, and he also fought for the media, which is very nice, considering we are in the media industry. You know, we are reaping the fruits of the trees that he planted.
Yeah.
Yeah.
Yeah. Also, that's just maybe to encourage all of us to take good care of our environment.
Yes.
Plant trees, take care of your water streams.
Yes.
I feel like we talk about trees during Mazingira Day quite a lot, and forget that we're supposed to take care of our water streams as well.
Yes, and we only plant trees on Mazingira Day, which is very sad.
Yes.
Yeah.
Yeah. There's someone who said that, you know, take it to court if you will. They were talking about the drainage system in Nairobi.
Oh.
And they said drainage system in Nairobi at this point in evaporation.
Okay.
Yeah.
It's bad, but then again, at the same time, I feel like as citizens, we should take care of our own environment. You know?
That.
Yes.
We have a part to play.
We have a part to play because people litter and then they say the county government will clean. So, you know,
we have our
both
part to
sides
play.
have
We
a
really
part
have
to
a
play.
part to play.
Yeah.
And this is not only for Nairobi,
but also for the country at
Mahali
large.
huko.
Yeah.
You have your part to play. There's someone who was saying that their contribution to the society is not littering around.
Oh, wow.
And that's something.
Yes, it's a very big thing.
That's a big thing.
Yeah.
Because if all of us would take that at heart, that you will not litter, then that means we'll have a very clean environment,
Yeah.
a clean Kenya.
A very clean country.
Yeah.
Yeah.
So if we all have a part to play, just make sure that you're just taking care of your environment, the water streams, the trees.
Yeah.
That would be really great.
Yeah. So who did you celebrate for Mashujaa Day?
Of course, Raila. Because you know, that was very at the peak at that time, so he just got to reflect on what was his contribution to the country, and that's a
and also
whole
to Africa.
conversation, and to Africa. That's a whole conversation to have, and we're just thinking about how we all have our opinions, and what part are we able to shout about it and tell people, this is what I think, this is what I believe in, because I do not have to believe in what you believe in.
Yes.
But do you stand by what you believe in truly?
Yes. And do you fight for what you believe?
Do you fight for what you believe in?
Yeah.
So we're just looking at that, but also my parents. Amazing.
Wow.
Amazing parents. So of course, my dad, the late, amazing. So just to reflect on because most of what I know now is what I learned from him. But also my mom, a strong woman, oh my goodness, a warrior.
We thank God for parents.
We thank God for parents. So also my parents and myself. I actually called a few people and told them, I'm just calling you to wish me happy Mashuja's Day because I'm Mashuja. So I'm waiting.
Because you're Mashuja.
Yeah. But it was such a great day.
Wow.
So we've just started this conversation. Please, for the people who are seeing you for the very first time, introduce yourself.
Okay, so good morning, everyone. My name is Mombi Kariuki, and if you're just joining us, this is a segment where we do a brief recap and also emphasis on the topic we discussed today. And today we talked about sepsis, or blood infection, or septicemia, and we learned a lot, so tag along. Yeah.
Perfect. Now you're taking us through the pointers, or what you've learned today. So from now, we need Dr. Mombi Kariuki. So please.
So even before the pointer, something that really stood out for me today was don't self-medicate your children.
Ooh.
Yes.
There's that. Children.
Because I've seen that a lot.
Yeah.
Ati akona fever hivi, you know, let me go and get dawa ya fever. Kumbe there's an underlying issue that's way more than what
the fever.
Ama, you know, anaumwa na kichwa hachezi sana, you know, let me just get A, B, C, D, E to see if they get better. And most diseases, most things that end up being big start as something small.
Yeah. Actually had someone saying, no, it was actually a pediatrician we had on the show. And she said, if your child has a fever, if you're getting a medication to lower the fever, you should be doing that as a first aid as you take them to hospital.
Because
Because fever is really crazy for kids.
Yeah.
So at least get something. Wanasemanga Puritan. I don't know. Please do not take my word on that. I have no babies. I might not know. But whatever medication you'd give them to lower the fever, let that be a first aid.
Yes.
You are on your way to hospital. Quick fast. Also, our director has reminded me of something. When I tell you about mtoto wangu alikuwa na hii shida, alafu nikampea hii dawa na alikuwa sawa. So kama mtoto wako kuna the same symptoms, in fact I have kuna hii dawa ilibaki. Instead of you buy mpe hii atakuwa sawa. So please don't self-medicate your kids.
Don't, especially, children are very sensitive, especially if they're not at an age where they can self-advocate and say, it's bad, I need to go to the hospital now.
They'll just be crying.
Yes, they're just crying or they're just sleeping or not playing. And you think, acha tu alale, ataamka kwa amepona. And it's very sad that we lose so many children because of that.
I love that you've highlighted that.
Yeah, so today we learned about sepsis or blood infection or septicemia. And the first thing,
love that.
And the first thing that we learned is a blood infection, also known as sepsis or septicemia, occurs when harmful bacteria, viruses, or fungi enter the bloodstream and spread throughout the body. So basically, a blood infection is an infection caused by bacteria, viruses, or fungi, and it enters the bloodstream and throughout the body. It often starts from another infection, like in the lungs, urinary tract, that is UTIs, skin or abdomen that spreads into the blood. So most of the time, a blood infection is caused by an infection from another organ or another part of the body, like the lungs or the urinary tract or the skin or the abdomen. Some of the risk factors for blood infections include a weak immune system, chronic diseases like diabetes, open wounds or surgery, use of catheters or IV lines, and untreated infections in the body. So back to the point of self-medication. And we've talked about malaria because they have similar symptoms. So you self-medicate. You say, I have a fever and I have chills and I feel tired. I think it's malaria. So you go and get over-the-counter drugs. So you have an infection in the body that's left untreated. And then eventually you get a blood infection. And we've been told it's a medical emergency. It is. You could die. There are people who go into toxic shock syndrome and their organs fail. And they die because of something that could have been prevented if only they went to the doctor earlier.
I hate to share this about myself, but just so that you do not do the same thing. And this is 2 years ago. So hey, I've mentioned it before. I know better.
You're a different person
I'm a different person now. Do not judge me using that. So 2 years ago, so it happened that I was having issues with my stomach infection. We talked about food poisoning the other time. So it's usually an issue of food poisoning, and then you just think, itakuwa tu sawa.
Let me take some Eno.
Self-medication. That happened, and it got to blood infection, and I was admitted to close to a month.
So sorry.
For close to a month.
A month?
Almost.
Wow.
So kiskiendoka kisema hii story ni serious. Please, ni serious. And then it hospital.
Go to the hospital.
Was
get checked.
3 weeks. But then it had an underlying issue of my immunity was really bad. Because also I'm those people. People.
Yes.
That didn't like to eat. So I'd probably survive on snacks. And I'd be good to go. But what that does is when you fall sick, with your immunity, you can't fight for yourself.
Anything.
So really, you need help.
Yeah.
So it's really bad. It's like a combination of stuff. So as Doka said, make sure that you eat well. Take a lot of fruits and vegetables because that really helps your immunity. Ukisikia kuna shida yoyote, please go get checked.
Go and get checked.
Go get checked.
Yes, your health is your responsibility. And health is wealth.
It is.
Yes.
It is.
So another important thing that we learned today is that the symptoms, the risk factors for blood infection again, we've said the weak immune system, and the symptoms for septicemia include chills, general body weakness and fever, which can be likened to malaria symptoms. So if you have any of these symptoms, and just any symptom in your body that you feel like, I'm not okay, seek medical help. Don't wait for the symptoms to persist. So when you
please and thank you.
Yes. So when you feel like my body is not as the way it should be or as the way it usually is, go to the doctor. You'd rather use that 500 now than use millions later.
True stuff.
Yes. So another important thing that we learned today is that it's a medical emergency, so early detection and treatment is critical. And not just for blood infection, for almost every other thing. Because most big things start as something small.
True.
Yes, it just starts as a headache, as a stomachache, you know, you just feel weak and tired, but it's an underlying symptom for something bigger. Yes, so go get checked. Again, your health is your wealth. Take care of yourself.
Yep.
Yeah.
Perfect. So now that we know that, as you've said, our health is our responsibility.
Yes.
Please take it as your personal responsibility to take care of your health. If you feel lately say my appetite has been bad,
yes,
go get checked.
Go get checked.
Just know what the issue is. So there's a doctor who said on set that know you're normal, so that when anything is off the normal, you know that you actually need help. Because probably your normal is you just don't have good appetite. So you know you're the kind of taking small portions throughout the day. So know you're normal so that anything outside your normal calls for attention. But that has been it on today's episode. Thank you so much.
Thank you for having me.
It has been great. Thank you so much for tuning in today. I know that you've learned a thing or two. What I'd encourage you is please go get checked. So that just to make sure uko sawa. Also to remind you, this month is Breast Cancer Awareness Month. So in very many centers, the ultrasounds, are they ultrasounds?
Mammograms.
The mammograms. The scans are either free
or subsidized.
So take this opportunity this month and go get checked, know your status. That would be amazing. This month is also Pregnancy and Infant Loss Awareness Month, so create awareness about it as well. Make sure that people do know what is normal in your pregnancy journey, so that anything abnormal will go get checked, so that utakuwa na complication at the end. And that would be very important. I know that one day, very soon, we'll be having that conversation here, and we've had that conversation a lot of times. Your journey of pregnancy, first trimester, second trimester, what to do before you get pregnant, after you've gotten your baby, how to take care of them, how to take care of yourself. That's very important. Others, thank you so much for tuning in today. That has been really amazing. My name is Rachel Kahugo. I'll see you next week on this particular show, next week on Wednesday. But before then, or up to then, do have an amazing rest of the week. Today, being a Wednesday, it means that we'll be having the lunch hours from 12:30 to 2:30. So do not miss out. You're going to be having an amazing day.
Yes, and also have an amazing week. And I've been your host, Mumbi Karaoke. Bye-bye.
Bye-bye. Thank you. Do have an amazing weekend. No, week and weekend. And then we'll be seeing you on Wednesday next week. Of course, from here, we'll have to wish you also an amazing weekend. And it's just Wednesday. Someone said that Wednesday is right at the middle of the week, but we'll be seeing you next week. So do have an amazing week. Ikifika weekend, do have an amazing weekend. We'll be waiting for you right here next week for you to share with us how your week has been. All right. Bye-bye. Do have an amazing day.